discussing the review that we did on global gender disparities in access to refractive air services. So this review summarized existing evidence on these disparities, and what we saw was that globally, women do have less access than men to refractive air correction. And we also saw that this was actually more, this was somewhat surprising, but more pronounced in urban settings and also in Southeast Asia and Oceania. What was unique about our review was that we looked at both adults and children. Previous reviews have looked at mainly just adults. And that was somewhat interesting. What we found, our results have to be taken with a little bit of a caveat because there were a limited number of studies regarding children. Actually, we could see an increase in studies that looked at children in refractive air coverage, but what we saw was that there actually wasn't a difference. The difference in accessing refractive air coverage became much more pronounced later in life.
What takeaways could that be taken from that finding? Does that counteract anything that we previously knew about the prevalence of refractive error globally?
I don't think it changes that. I think it could actually be seen as a success story. The articles that we did include in the review that we were able to analyze actually were looking at school screenings, and that is where we get a lot of our data and evidence on refractive air coverage for children. So I think it shows that these are actually a good way to have interventions because we do see equal numbers of boys and girls presenting in school. What that leaves out is the kids that aren't in school. So we do have to take that into consideration and have, targeted interventions potentially outside of schools. But I think it shows that school screenings are actually a very effective means of intervention.
To kind of switch gears a little bit, you had mentioned previously about that urban disparity for women and refractive error correction. Is this something that has previously been found, or why do we think that this disparity exists globally?
Yeah, I think, again, a very interesting question. We always are thinking about remote and rural areas having limited access to services. And I think while that still holds true, that's true for both men and women. And when we're in urban environments where there maybe aren't as many geographic limitations, we now have sociocultural kind of barriers and access to care. And that's probably our greatest hypothesis on what is addressing that.
So, what overall would you say contributes to that lack of women's access to eye care on that international scale? I know you touched on the urban disparity piece of it, but just kind of looking at it broadly, what are those factors?
Women have greater caregiving duties. So finding services and places of care where maybe the children can come with them so that they don't have to find additional childcare support. Maybe sometimes it's bringing those services to the workplace. We see a lot of workplace screenings, but that's sometimes more in traditional men workplaces. And now, at least Orbis International is certainly looking at bringing those to areas where there's more women working. So different ways to kind of look at those indirect barriers and access to care within time and accessibility.
I know that there in that review there was a discrepancy of the country and income plays a big factor in that access as well. If you're segmenting the countries into those two categories, how does that approach to improving access to eye care? How is that differentiated, or how is the approach different?
I think that we have to look at ways to subsidize care, ways to make care affordable and available, whether that's within the infrastructure of a high income versus a low income country, or if that's looking at ways that once you seek that care, is it treatable? And certainly getting glasses for refractive air is a very affordable intervention, but we have to make sure that those glasses are still affordable within the context of the environment of where we're screening.
So, taking a US approach, I know that this is a global review, but what can practitioners that are practicing in the US, how can they interpret these findings into their own patient care?
I think that it's everywhere. I think that we see, advances within the US of being able to address this, and maybe it's not as pronounced, but I think there's still ways to make more women-friendly clinics or parent-friendly clinics. It's not even just always the women, especially in the US, that are taking care. of their families at home, but it is, how do we make accessing care accessible? Even for myself as a working mom, I have to juggle, is it, when do I do it during the day? Can the kids come with me? Is there a waiting area that might be comfortable, a place to do homework, etc.? Is there an opportunity for, at a health fair that I may be going through at the farmer's market? I think there's creative solutions to find areas where we can access care in kind of women friendly or parent friendly or all types of friendly environments.
Anything else that you wanted to add that we haven't touched on?
I think that it is always exciting to look at reviews and kind of see where the gaps are in the evidence base and where there's opportunities for new research and where they can address and kind of direct us towards program interventions and policy and advocacy overall.